girls who live in Virginia, this is a time for some political courage to do the right thing for everybody. And I thank you for your time.
Chair recognizes the senior senator from Richmond City, Senator McClellan.
Thank you, Madam President. I rise for point of personal privilege.
The senator has the floor.
I was not quite a month old when the Roe decision came out, being born in December of 1972. But the fundamental right to reproductive freedom, as outlined in Roe and its progeny, was something that I had always taken for granted and never really thought much about, other than philosophically. I believed that all healthcare decisions should be between patients and their providers. 13 years ago, this year, I made history on the other side of the hall. The senator from Fauquier beat me to it, being the first member of the General Assembly to be pregnant. And those of you, all of you, have probably known me well enough to know that when something interests me or affects me, I have to know everything there is to know about it. So when I found out I was pregnant, I had to know everything that could happen. And with the internet, I found a lot of bad things could happen. I was 38, and so it was considered a geriatric pregnancy, high risk because of my age. So I had more ultrasounds than younger women. And I remember when I first went to my doctor, we were debating the mandatory ultrasound bill. And we talked about it. And it hadn't made it to the floor yet, and I wasn't, we hadn't debated it yet on the floor. And I went to my ultrasound, which is transvaginal in the first trimester because you can't see anything abdominally. And I remember my ultrasound physician saying, he was very excited. He had a legislator who was a captive audience, literally. And he said, I often will get into discussions with my friends at cocktail parties who profess to be anti-abortion and talk about my patients. And you've heard me tell some of these stories. The patient who had a hole in her heart couldn't get pregnant. She was on birth control. She got pregnant anyway. She had to make a tough decision. The patient pregnant with octuplets, and the chances of any surviving were low, but if she reduced the pregnancy to 2, odds were they'd survive. As he talked, I thought about my friend who a few weeks earlier in her 7th week of pregnancy suffered fetal demise and had to have a D&C. You've heard me talk about women who were basically told if and when we deliver and cut the umbilical cord, immediately your baby will suffocate because of the abnormalities. And most of these stories involves people who got devastating news at the first ultrasound in the first trimester, but they wanted a second opinion, or they wanted to wait to be sure. So they waited till the 20-week ultrasound or later to be absolutely sure. And I went back and we debated the ultrasound bill. Now, it wasn't public yet that I was pregnant because I was still in my first trimester, and I'm just superstitious enough. But my seatmate knew, and the speaker knew. And I stood up on the House floor and I told these stories. And I thought about my friend waiting to get her D&C. And I started to get angry. I said, are you telling me that she will have to get another ultrasound, be asked to look at it, be asked to listen to a heartbeat that both the provider and she knew weren't there. That was the bill we were debating. That was the bill we ultimately passed. That was the bill we ultimately repealed. Now, in 2015, I had a much more, my first pregnancy was theoretically high risk because of my age, but it was textbook. My second pregnancy was high risk because I had placenta previa. And 9 weeks before my due date, right after we had scheduled my C-section, my placenta burst, and I almost bled to death. And I remember being rushed to the hospital, and I remember hearing a doctor say, everything looks fine, and then immediately saying, we got to go to labor and delivery. And hearing my physician, the last words I heard saying, I'm here and I'm going to take care of it. And later, when I realized the severity of what had happened, and after Roe fell, and we started to see the bans take effect in other states, and we started to hear stories of physicians who hesitated, I said, in my case, I'm really glad that my doctor didn't have to think about if that delivery went wrong, could she be prosecuted? Because in other states, when things have gone wrong and someone has shown up, they'd have to ask, are you close enough to death that I can intervene without prosecution? Do I have to wait until you need a hysterectomy? Do I have to wait until you have sepsis? Or can I make the decision as the provider that my medical training and the standard of care tell me to make? So that's why this issue has been so personal to me. And I've been accused of you only tell the sad stories. That's right. Because those are the stories that are impacted by the laws that we pass. And a lot of those patients aren't here to tell them, or they're scared to tell them, or it's too painful for them to tell them. But somebody's got to tell them. Now, I'm still of childbearing years, but more likely than not, if I get pregnant, I'm going to die. So that's something probably for a couple years I've got to consider. But here's what really makes me mad. I'm the first generation of my family to lose a constitutional right in my lifetime. But I had the right to make those decisions in my childbearing years. My daughter, who I almost died giving birth to nearly 8 years ago, she might not. And that's why I tell those stories, and that's why I put the bills in, and that's why I say, I may be fighting the same fight that my mother fought before Roe, and my grandmother, but I'm sure not leaving that fight to my daughter. I will continue to fight for the reproductive freedom of every patient so that the decision can be made between that patient and their provider. Thank you, Madam President.
Chair recognizes Senator Morrissey, the junior senator from Richmond.